Hey you guys, welcome back to The Gentle Life. My name is Precious, and today we are going to talk about stimming. There seems to be a lack of understanding of what stimming is, and I want to help clarify and help identify what those signs are. For those of you that don't know what stimming is, it is self-stimulating behavior. So it can be done with noise or repetitive hand or body movements. Stimming is not only dedicated to people in the autism community. Neurotypical people can stim as well. Some examples of stimming that you'll see could be hand flapping, it could be clapping, any type of finger mannerisms. It can be rocking back and forth. It's anything that'll help someone self-soothe if they're having a hard time, if their anxiety is really high. So something that's going to help them re-regulate their body. Although stimming is used as a behavior to help someone in a case of high anxiety, it can affect their daily lives. With our daughter, it affected the way that it affected her in a way where she couldn't learn certain things. So being able to feed herself. So at 2 years old, she still wasn't able to use spoons, utensils to actually feed herself because she's so busy stimming. And so I think that with autism, it's something that's really not controllable. As far as if it's with someone that's neurotypical, they have the know-how to know when to stop stimming in certain situations. And with autism, you don't. I think that stimming can be a benefit and it can be a detriment. And I say that because, for instance, with our daughter, her stimming currently is that she sucks her thumb. And at her age 3, that does affect her teeth, how her teeth is forming, which is also affecting her speech. At a young age, it isn't so much a detriment to her teeth because that can be fixed. And even speaking with her orthodontics, like he said that it would be better to let herself soothe herself at this age, and it wouldn't be a problem for her until she turned 4 or maybe around 5. I think that if it can be a detriment to their future, I think that it is our job as their parent to help them find different ways to self-soothe, different ways to get through their struggling points. Because you don't want to tell them that they shouldn't self-soothe, that they should not, cope and find ways to help them through those problems. I think that trying to stop it completely is more detrimental than to helping them find a different way to self-soothe. The only time that I would recommend a parent stop someone from doing a certain stim is if it is harming them in that moment. Some of those examples would be if they are headbanging. Another example would be if they are scratching. That's detrimental to them right now. If they are flapping, if they are clapping, if they're just doing hand, movements, or even just rocking back and forth or side to side, I don't think that that's something that you should stop. I don't think that that's a problem. At any point, if you are trying to stop your child from stimming, you are going to experience some type of reaction. They aren't just going to stop because you tell them to. With Miko, if I take her thumb out of her mouth and I hold her hands, right? I'm not holding her hands tight. I'm just holding her hands down. She thinks that it's a game. So she's laughing and she's playing for maybe all of a minute. After that, she's crying. And now she's trying to force your hands off of her. I think that there are ways to help someone stop, but I think that you're not going to be able to know that without trial and error. You're going to have to try different things. I don't think that it's just as simple as just removing you can't remove her body. I can't take her thumb away. I can't stop, her from rocking back and forth. I can't hold her all day to stop that. So a healthier option would be to give them a distraction. If I give my child a toy that requires her to use both of her hands, the more I'm providing her with the distraction to use her hands, the less she's sucking her thumb, which could result in her not wanting to do that anymore because now she's just focused on a lot of things around her that require her to use both hands. You also want to keep in mind that just because they stop one stem does not mean that they can't develop another stem, even if in that example of doing it in a healthier way. There are things that are sometimes out of your control that can lead to other stems if they go through a traumatic event. With our daughter, we went on vacation for the first time when we first learned that she was autistic. She went from clapping as being her main stem, really her only stem, to then coming back from that trip, it turning into thumb sucking and hair twirling. And I say a traumatic event. I know it doesn't sound like a traumatic event by saying you guys went on vacation, but it was the fact that one, we drove for 16 hours. That it was supposed to be 16 hours. We drove for 20 hours. And I think taking her out of her comfort zone and taking her away from, yes, that safe space into a place where she was unfamiliar and around people that she had never met before, that was the trauma. And because she couldn't revert back and go to that safe space when her anxiety was high, it caused her to develop and do something else to help her get through it. So even stopping one or even if she had just developed another stem, because sometimes you can't stop one and they just develop more than one stem. And children are not the only ones that can stem. You're not only going to see these examples in children. Adults can stem as well. For example, my husband, he paces back and forth. That is a stem. You may also notice that maybe you or someone you know stems in a way where they bite their nails all the time. They pick at their scabs all the time. Self-soothing can also be a sense of self-harm as well. Drug use, anything that you're doing that is a repetitive behavior to help you soothe and bring your anxiety down is considered stimming. So I really hope that this answers your question of what stimming is. And I hope that some of these signs that you guys are seeing in your child, you're able to recognize if it's something that's harmful or something that they actually need. I think it's very important for you to just pay attention to your own child. Some of the stems that I've said may not be a stem that they're doing, so don't just listen to this video and think that because your child isn't doing the stems that I'm saying that they're not stimming. Just pay attention to your child. I think the most important thing to know is if your child's stimming has changed or if it has increased, that is a cause for alarm. There is something there that they're trying to relay to you that needs your attention. So at the end of the day, the only thing that you can do as a parent is to just observe and pay attention and be there for your child. Don't forget to like, subscribe, comment, and hit that bell notification so that you guys don't miss another video. And as always, we appreciate you guys. And until next time.